Now we wait for the screen to appear. It doubles, it splices, um, and we'll see what happens. I always feel like IG Live is there. We go.
There we are. Hello, it worked.
You're my favorite person.
I don't know how to work these things. So,
It's
but
perfect.
you
By the
did it.
way, I'm in social media and I don't know how to work it, so
Yes, and it worked out
it worked out.
so far.
Um, it's so far I know because I was like, let's do an IG Live. He's like, great, I'll see you in the office at 1:30. I'm like, no, no, we do the split screen.
Yes.
It has to be like this. But anyway, today marks the fourth week. Like
Yep.
literally, I was saying you probably were, I don't know, were sewing me up at this time. Who knows, 1:30
Yes.
4 weeks ago.
That was 1:30 was about when we kind of got out of there. So it's perfect.
Perfect timing. It's
You
wow,
you you had
auspicious.
such a great surgery, and look, you like showing your journey like completely in real time. There was no delay. It was within maybe an hour or two of recording things, it would come right out.
But what
And
I had no idea. It's so funny. Like I literally had no idea that I was gonna go off the rails because I remember, you make a thing. You're like, yeah, we'd love to share your picture on our Instagram. I'm like, of course you can. But I was like, I really don't like when people show those like the next day and they look like a baby alien. It's kind of gross. Like maybe we'll. I literally came out of that surgery. I looked like a baby alien. I just something
yeah,
the actress kicked in and I was like, I'm going hog wild. And I went insane. I had no idea that I was going to be this public and explosive, but I just thought it was hilarious. I mean,
yeah,
besides the fact that it's educational, I just had so much fun. And I'm like, I just went crazy. I actually don't know what came over me.
yes. Well, then I appreciate it. It just
No,
was fun for the first few days. It was like, okay, all right, there it is. All wild and everything.
I was having
Stitches and
friends going
everything.
like, "Stop! We're having jump scares. I'm muting you." I was like, "It's okay." I just characters were coming out. I just found it hilarious, but also at the same time, I was like, you know what? No one really does know this, so let's just
Yes.
pedal to the metal.
Yes.
And also on the note, when people think that we do these facelifts for the male gaze, I will say I have made myself 2000% undateable. So there you go. There's your answer. I was like, I'm doing this for me. If I was really doing this for anyone else, this would not be so public. So I
Got
think
it.
that is a good note because a lot of people say, is it really for you? I don't believe it. I'm like, no, it's for me. Like I'm not leaving the house and I'm
Yeah.
showing oozing wounds on Instagram. So
Yeah.
1 month. So here's the thing. People always say to me, how come you chose Dr. Davis? Blah, blah, blah.
Hmm.
And like I always say, I did not even know I wasn't going in for a consult. I was like writing a new article for my Substack on the sort of under the radar plastic surgeons that we don't have these huge, like bombarded with press that feel very
Instagram famous,
machinating.
all that. Yes.
Yeah, which for me personally, frankly, it's a turnoff on so many levels because it's just like, why is it? Why do you need to go so hog wild? Like, do your surgery, have your life, get a little press. Like,
Yeah.
what is the point? What is the goal? So that always makes me feel a little icky. And then we met because I found you on Instagram. This wasn't a press push. This wasn't a PR person reaching out
Hmm.
to me. And I was like, whoa, what is that? Who is this guy? What is this? What is this work? Like, this is incredible. So I was like, I wanted to write about you. And then by the end, I had put down a deposit and I was like looking at dates. I didn't know what happened. I was
Yeah.
so impressed with, you know, what you talked about technically. First of all,
Hmm.
you as a person, the office, the whole vibe
Sure.
is very down to earth, very real. It didn't feel
Hmm.
artificial or
Yep.
artifice. It felt very authentic. And then I talked to you about your work. So what is it that makes your work so special? I mean, I don't know. That's a weird
Well, so no,
question.
so first of all, when people are looking at their surgeon, I think one of the more important aspects is, we get along really well. It's important that you get along with me, I get along with you, because the recovery process is a journey. It's not just the day of surgery. I mean, you're 1 month out. I talk about these things being at least 6 months. So you're going to still get your swelling is going to continue to go down,
Oh yeah.
and if I'm not there for you during at least that 6 months, or on top of that, if my staff and my
Yeah.
clinic is not amenable to you and won't pick up the phone for you, or with that kind of stuff, that can be scary. So that's important. Like number one, And number two is a lot about the technique. So as a facial plastic surgeon, we're in we're in this anatomy day in, day out. So a lot of the techniques to make someone kind of reset their tissues and appear more natural is something that people gravitate towards our practice with, and that has a lot to do with the technique and the experience. But so I mean, it all comes together. So having a nice relationship with my patients is very important, and the technique and the experience, that all comes together.
It's true. It's definitely a multifaceted, of course, tech
Yes,
surgeon,
yes,
certificate, all that. Obviously, that feels like a no-brainer that you have studied who the surgeon is, who did they study, but then also things that you might not think about is like the office, the vibe,
hmm,
the people, like you are dealing with these people, and the first line of defense, oh, sort of like the after
yeah,
months later is you're calling the office like and you're running things through them first and
yes,
they sort of are like filtering it like okay we need to get you in or this and that like you need to have that staff that's really like so tuned in
hmm,
and warm and amenable. And I really did fall in love with like every first line from like walking into the the girl who sits at the desk, like everything just felt cozy
yeah.
and real, and like I wasn't going to get tossed aside once I had that surgery.
Well, Emily, you say very nice things. I appreciate all those things.
But it's so nice. It's just
Yeah.
true. It's not like,
Well, we just tend to be more, we are more boutique in the sense of
yeah,
it's more of a concierge type experience. We don't tend to do a lot of ancillary medical spa treatments, although those are available for our patients. This is a surgical practice, specifically designed for the face.
that
And
might be
that's
it.
what yeah, that's all we do.
That might be it.
A lot of people ask me what, as
I
far
mean, not
as,
it, but part of it.
yeah, what is the real reason for choosing a particular surgeon? I think it's frequency with which you do a particular procedure. So it's not entirely about being a facial plastic surgeon, just a general plastic surgeon as well. If they focus entirely on the face 2 or 3 times a week, then that's great. So if they're doing it frequently, I think that's the one of the most important things. And who you train under is important, and then you have to evolve beyond that you can't be stuck in your ways and keep
Hmm.
moving on with different techniques. So I mainly and exclusively do a deep plane technique, which is very much in line with people that want to appear natural, because we're just resetting the tissues vertically back where they once were, and you just cannot do that with traditional techniques. But having said that, I've moved even beyond that, in the sense that we're still doing, like Emily, what you received is a deep plane, but also the skin itself is. I'm very careful to not take off and get to that access point any more than I need to. So that's called a preservation kind of
Mm.
technique on top of the deep plane technique, and it's may make every effort to go vertical. When you pull to the side, it can look good for a while, but then over time, that gravity still falls vertically, and then you get these kind of windswept looks, or the Nike swoosh that can occur.
Yeah.
I just, that's not something that I want to have in my patients, and that's why people come to me for that particular
Yeah.
reason.
Well, it's so funny because in the past month, I've literally made a full-time unpaid job about being the internet's facelift advisor.
Yes,
I'm like the internet's intern, and I have been talking to women literally all day long, no men yet, about this and questions.
yes,
And should I piecemeal it? I just need my neck. I would have, and I'm trying to sort of field. I'm trying to field
yeah,
people to the professionals, but in the
yeah,
meantime, from what I've learned, and I do, when you said that thing and the Nike swoosh, and we talked about that, it
yeah,
made me think of a couple of people that I spoke to over the past, this past moment in time, who said, "Well, I just want to do my thing, the this," and I was like,
yes,
"Oh, but then this is going to fall, and then you're going to have a, you know." Which is another question. Is that why the ponytail lift is short term? We're going to get to that ponytail lift. That's a great question.
yeah.
Um, I do think that's interesting because you also look at the face very holistically in that sense of like, we don't want this to happen later because we went this way or that, it's,
Yes, yes,
yeah.
yeah, and yeah, especially that question about the ponytail lift. it's really important to you have to have access to the actual anatomy and the aging face. So we age vertically. That's not a surprise. There was a huge article in Nature, which is one of the biggest publications of all science, that talked about the aging process being more of a stepwise decline rather than a gradual decline. And around the ages of 40 and around the ages of 60, there is like, and I have patients that come in will say, look, doc, I noticed in the past 2 months, my face has just kind of changed. And I used to,
Suddenly.
yeah, and I used to think that that wasn't necessarily a thing. I thought it was definitely more a gradual process, but we age vertically. The ligaments and such in our face get lax around those times. So any technique that doesn't specifically address that is going to miss the mark about making someone look natural. And I equate naturalness to what being look familiar. So like, what are you familiar? Like when you look back, I often look at people's photos 20 or 30 years ago, your cheeks were up here and that's why there's hollowing. So it makes sense to bring the cheeks back up. It does not make sense to pull them to the side because they never were over there. That's not what is familiar. That's not what's natural. It's easier said than done to do that, but that's what we have to strive for, at least in the aesthetic that my patients are going for.
Right. Well, that's interesting. And on that note about the ponytail lift, because I've
Yeah.
had a lot of questions about that, I also think that it's interesting to note that in facelifts right now, there's a lot of branding going on, and
Yes.
there's names, and then the doctors need to differentiate themselves and stand out and create a brand name. And I do think the ponytail has become a branded name, and
Yes.
they talk about the scarless or the endoscopic, and I don't know, as you say, about skin being removed. I don't
Yeah.
know if that ponytail lift is removing what that is doing. I don't really know
Yeah.
too much about it. It was never super an interest to me because it felt a little bit like, I
Yeah.
don't know if
It's
it gets to the
so.
deeper layers.
Yeah, the ponytail lift. So take a step back. We are in the era of undetectability.
Right.
Not only do we demand it, but it's actually being achieved, and it's important where you place your incisions, um, and because even if you place your incisions right up here in front, which I don't, even if it heals really well, you're taking away some of this temporal tuft of hair, and people
Hmm.
can notice
Hmm.
that sharp demarcation. So my incisions are up into the hair, my incisions are into the hair itself, and that is a lot of what the ponytail lift is doing. Now, there's some aspects of the ponytail so that, you know, its actual technique itself, it needs to address all techniques need to address this particular area. This is called McGregor's patch. It's like literally holding our face up. If you have not had surgery, this little area is holding your entire face up, especially vertically, and it's all connected from here to here to here to the bands down here. So if we're not going through this and then replacing it with this broad area of tissue lifted up and re-welded into place, which is the deep plane technique, we are not necessarily getting to the actual root of why we're aging. If we're only dissecting here with like a camera and kind of getting this area, we're neglecting to get out here. Now, I'm not going to speak to the technique and being able to get here with the ponytail lift, but when you do lift and bring those tissues back up, there is some skin that has to be trimmed. That's unavoidable. But the way we hide it, and the way I hide it, is it's very difficult to see. And the main reason is because the incisions are hidden well, and also that deep layer, it's like making your bed, it's the deep blanket layer. That's what's holding up all the tissues. Like Emily, in your face right now, your deep layer is being held on. All those stitches now have dissolved. Now it's re-welded into place, or re-scarred into its place. And there's zero to no tension on your skin itself. The skin
Yeah.
is closed. When I close the skin, it's like two pieces of fabric that are just gently touching each other. So the fact that there's going to be likely very imperceptible scarring because of that lack of tension.
Right.
But it's that deeper layer that's holding everything up and re-welding itself into place.
Wow. I didn't realize that there are actual stitches in this area.
Yeah, so nothing in your face is
So that,
permanent. Everything
right.
is dissolvable, but okay, let's think of the bed. So in the morning we make our bed. I try to do it every morning, but who knows? Sometimes
I
I mess
mean,
up.
some people do. Yeah.
You have the comforter, which is your skin, and then you have a deep layer, which is the blanket. So you go under the skin just a little bit, or under the comforter just a little bit. That's the preservation technique. We're preserving that layer. And then we dive into the blanket. And with the blanket, I go all the way out to here through that little McGregor's patch to the nasolabial fold, and then lift that blanket vertically. That brings the skin along with it. So the skin is just along for the ride, and that blanket then re-welds itself deep on your structure. But for the first week or two, I have to have some stitches up there to hold it deep into place.
Okay.
But then those dissolve. Like in elevated design for clothing, one of my patients said that's called a secret stitch or a slip stitch, meaning there's stitches that are deep that you cannot see that are holding you up temporarily until your body reaffirms itself into place. And yes, Emily, like now I love the way you look, and it's going to continue. But in the next 10 or 15 years, compared to an Emily who did not have this surgery, you are both going to continue to age, but your face is a little bit stronger because that blanket is now reattached and then now re-welded into place.
And doesn't that sort of stimulate the collagen-y, what, you know, the
yeah. Yeah, so that does too, because the scarring itself has collagen in it. That's the scar process.
Right.
And the phrase scar may sound scary to some people, but in this case, we want that deep layer to, I like to say, like, weld or scar itself back into place deeper in a stronger manner than it was even before.
Right. I didn't, you know, it's funny. I was doing the brushing, and
Yes.
then I finally did the session with Cecily Braden, and I was like, I hope I wasn't like disrupting anything. Like you can't.
No, it's
Okay.
very durable. Like,
Okay. I'm like, did I mess up any stitches? I mean, I look pretty good. I can't stop looking at myself, but I literally am just basically staring at myself.
Well, look, if some of the other techniques that are relying on the skin to hold you up, I would be concerned about pulling or things like that. I mean, you had a dressing on you for about 3 days, and then after that, I don't necessarily need you to have a compression bandage because all of the work is deep. It's not related to the actual skin itself.
You mean like a smash or like a one stitch thing? Like what are you referring to?
Well, so I firmly believe, and I can't test this, but once that deep layer has been lifted, I would say at least 3 or 4 days, that tissue has reset itself into place. Now, I'm not going to change my postoperative plan. I'm still going to say in 3 weeks, you should, then you can start lifting heavy things. But if I had to make a guess, at 3 or 4 days, that tissue is really locked into place, or at least well on its way. And the stitches are just literally there until they dissolve in 3 or 4 weeks.
Yeah. I mean, this is like a mysterious facelift. Like I don't even have like a white, like I'm a trainer, so I train clients, and I'm looking at them really close, and they've all had these fancy facelifts, this, that, but I see like a white, beautiful, lovely, but like a line, and I'm just like, oh, like you have taken this to the new level.
Yeah, I don't get the line out front. That doesn't. So you have this little thing called the tragus that goes right on the edge of the tragus. Yeah. My goal, and I talked with you, Emily, before your surgery, I don't want your ear to change one bit, as in the process. And then it's so important. So these little hairs that we have here, I have a decent amount of them. We use them when we go in the mirror and take a look. But once you make an incision through there and lift, then this little temporal tuft goes away. And when that goes away, you could, even if you have this cute little fancy stitch a little incision, it's because now that's gone that you have this kind of sharp look. And the eye, when other people are looking at others, we want kind of irregular lines. We don't want to see that sharp demarcation. I avoid it altogether and just go up into the hair. But that also allows me then to lift more vertically. So there's a lot of other things that I've evolved to do in my facelift, but which may be beyond this conversation. But in the importance is the undetectability. I mean, you could walk around and it'd be very difficult for someone to say that you've had anything done.
I know, except for me announcing it to 7,000
except
people.
For you,
but that I say
for
that
you announcing it right now.
Yeah, I was like, if I'm not talking about it. Okay, great. So let's talk about two things, about the whole dissolving filler debate, filler. Everyone, it's like, I feel like I open up Instagram, everyone has a point of view about this.
Yeah.
The injectors don't like hearing it from the surgeons. I thought you had a really interesting point of view, which is almost a little neutral in a sense.
Yeah.
So let's
So
speak to that.
yeah, fillers, hyaluronic acid fillers attract water. That's how they work. Okay. So my thing is, I like I just did a surgery this morning, and I could see the glistening filler that's deep. It's really interesting to see it in live in anatomy. The issue is when you have a lot of filler and you're recovering from your facelift, there's a lot of fluid, right? There's a lot of fluid that's trying to heal you. That's just what the body does. And then the residual filler that's there will attract that water, and you'll have a prolonged recovery.
Mm-hmm.
We used to think that that filler lasts for 2 years. There's been a lot of studies that have shown CT scans that are gated specifically to see filler that has lasted 8 to 10 years. So especially around your cheek area where I find the most kind of swelling, I,
Mm-hmm.
I highly recommend dissolving that filler, and you dissolve it with hyaluronidase. There was a recent paper, a review article this came out from our journal, that we're really actually moving away from calling it dissolving your filler, because you can dissolve your filler,
Mm-hmm.
but it's more modifying your filler, because it's even with ultrasound, it's difficult to get it all out. And the filler itself can also disrupt your lymphatic drainage. And Emily, you've been so good with that lymphatic brush, and that's awesome. But if those little filler molecules are disrupting an already very tenuous lymphatic drainage, you can have just this prolonged swelling. So I highly recommend that gets dissolved beforehand. But
Do
it's very
you?
site specific. Yeah.
Yeah, I mean that's the thing. Do you need to can you eyeball that, or are you doing it with the scan, or like what's your
Yeah.
theory? How many days before surgery do you recommend a few sessions? And
Yeah.
also you can have something like, I didn't have filler in my lips, but I definitely had a lot of filler above my lips that was
Yes.
weighing it down and giving me that heavy lip, and
Yeah.
I couldn't wait to dissolve it. But then you kind of start to get this weird puckering and dimpling.
Yes.
I forget what it's called, SF something, and there's a name for it, where you get
Yeah.
Jen Hollander told me, she's like, you
Yeah.
get a hollow and it kind of puckers. It's interesting.
Yeah. Well, are you talking about with filler?
No, she said, well, we were talking
After
about when you get
dissolving
the
filler.
filler, when you get the filler removed. Like right now, I
Yeah.
also, yeah, you get like a
So yeah, I don't know. I don't have a specific name for it,
right.
but oftentimes filler in the lips will migrate upward.
Mm-hmm,
So from the red lip into the border of your lip into the white lip, like we
mm-hmm.
call it the white roll, like kind
Up
of,
here.
yeah, up there. And then if you dissolve it, yes, I could totally see how, and I see that all the time, is that specific area now does not have volume there, so the skin itself can become a little puckery,
Right.
because the expansion and contraction that occurs, it's that is real. And for the younger you are, the better you can bounce back. The skin itself has elastin in it, but as we all get older, the elastin changes. That's that elastic component of our skin. And so when we expand and contract, if we keep doing that with fillers, much like I'm seeing with people that are on GLP-1s that have lost a lot of weight, that the skin sometimes struggles to contract
Right.
around what has been lost.
What about the more, I'm not going to say permanent, but the more sturdy fillers like Sculpture, or something that has a little bit, is Sculpture something that you find later, or
So a couple things. I like that Snoopy Pen is talking about, what
yeah,
about
yeah,
temporal
hi
filler?
Snoopy
So
Pen, yeah.
so that would be a good example. Temporal filler, especially as we get older, I think it's great because it's a very deep area. It
That's right.
does not move around a lot. So as far as being dissolving, it doesn't tend to migrate. So something like that, I would not dissolve. The cheeks, I tend to dissolve a lot. If we're doing lip lifts, I will dissolve that, so I have a good understanding of what we're looking at.
Mhm.
Because 5 years from now, we don't want that filler to go away, and then all of a sudden we should have either taken more or less, that kind of stuff. Deep filler, like in your chin, I wouldn't necessarily dissolve that. It's the ones that are kind of in the tissue that kind of will attract water that I do. Things like Sculptra, I have nothing against Sculptra. I think Sculptra down deep to stimulate collagen formation. I don't tend to have as many issues with that, and
Interesting.
it certainly doesn't affect the surgery itself. Um, if properly placed, Sculptra is it's a deeper injection to stimulate that bone growth and stimulate that collagenesis. So those I'm fine with Sculptra.
Okay, that's great.
Yeah.
That's great. All right, so let's talk about the great fat, the
The
fat,
great fat debate.
the great fat debate, the
Yes.
transfers, the nano fat, the
Yes.
FHAT fat. I was so excited. I had, very deep hollows under my
Yep.
eyes, and I thought I needed a lower bleph, and I love that you were like, you know what? No.
Hmm.
And I asked you many times about that. You said, "Let's work. We'll do some fat, and we'll see how." By the way, we'll see how it is.
Yes.
So, but so far it's great. It's still. I guess fat takes a while to adhere or to. I don't, what is the
Especially
process?
under the eyes.
Yeah,
Especially under the eyes.
because the
So
thin is so skin. The
that and
skin is
if
so thin.
anybody, yeah, if anybody has allergies in their lifetime will know that the under eyes, no matter what, just loves to hold on to fluid. I mean, if you ever got hit in the face on the right side, you get a bruising over here. That's how
Hmm.
the eyes work. So they tend to take a little bit longer to heal, even if you did not have fat transfer. In a facelift in that surgical world,
Hmm.
the eyes are always an indicator of where you at your recovery journey. And again, I know you're looking great, Emily, but it's 6 months. You got to hold on for 6 months.
I know. And that's another thing is that I
Yeah,
keep telling in my advisory, it's just patience. Like, just enjoy the process. It's
yeah,
going to change. You'll wake up and everyone talks about like, don't get seduced by that 2 week look. Cause after two
yes,
weeks, you're like, and then you swell up again. And then it goes, I mean, it's such a long
yeah.
process.
And also, like I told you this, the face is cut in two, and as far as drainage. If one side's puffy, the left side's not going to take on that puffiness. It's going to be puffy over here, and then all of a sudden the drainage will come down. Either you go to a lymphatic masseuse, or you're using the brush that we recommend, and then all of a sudden this one goes down, and then this one's puffy. So it is common during this recovery process for people to call us and be like, "Hey, one side looks a little different than the other," and it goes through that process.
Yeah.
So I'm really happy that you know that, but
Oh
that's
yeah.
something we kind of strive and to educate and stuff like that.
Yeah.
So the great fat debate. So fat itself has stem cells in it. There are adipose tissue of stem cells, growth factors in it. I often take fat. So this is called fat transfer, where we're taking fat from another part of the body and placing it somewhere else. That's to be distinguished from fat transposition, which is basically taking fat from specifically under the eye, orbital fat that's still there, and then not robbing it of its blood supply and just moving it down into the tear trough. So the decision between which one to do is a lot to do with how much fat you have under your eyes. If you're very hollow and you don't have a lot of fat pooching out, then you need to have something that will fill that area, which is the fat transfer from your either your abdomen or your inner thigh. If you do have a lot of fat in that particular area, we can get away with transposing that fat to kind of fill up the hole, and then layering fat from your other parts of your body to transfer on top of it.
Hmm.
And so under eye has been a big use of that. Temporal filler, instead of using actual hyaluronic acid, but using fat. That's a very common area to place fat. And then other parts, your nasolabial folds, lips, all that kind of. It's
I don't remember what we did. I think we did. I know we did this. I think we
yeah,
did this
we
a
did. We
little
did
bit
temples as well.
or
Yeah,
wherever. That was it. Just those two
yeah.
places.
Yeah, and
Right.
I may have I have to look at my notes. We may have put a
A little
little
bit.
bit in your nasal
Great.
labial folds. We don't, my aesthetic is not to make you look completely flawless in the sense of like we as humans we do have nasolabial folds. Even when you're
Yes.
20 years old, you have
Yes.
nasolabial
And
folds.
I want them. I want them. It's
Yes.
so funny. I've been doing a lot posting on TikTok for my 500 followers. And one of those 500 followers was like, "What about the nasal label?" I was like, "They're like, are you going to get filler?" I said, "Absolutely not. Like,
Yeah.
I like looking cute. Like, I was like, I love having nasal. I love having those. I want to look as real as possible. Will I do a
Yes.
little Botox? Absolutely, but just but Botox so that when it's affecting expression and
Yes.
mood as opposed to aesthetics, I do it for appearance like when you start looking angry and sad, that's
Hmm.
one thing. But Botox to look frozen that's not the aesthetic that
Yeah.
I'm going for.
Yeah.
So that's really
Absolutely.
interesting.
And then so fat. I think the fat. I would divide it, and you can divide it even further, but I would divide it into two categories. One is when you talk about fat transfer and taking it from the body, micro fat versus nano fat. So micro fat, and it's all about how you process it, how small you make those fat
Mm.
cells, and that substance. Micro fat is a little bit more, I would akin to like a filler. So it's a structural
Mm.
filler that goes into the actual underneath the skin, and especially under the eyes or in the temples. We're filling in a volume area that has been lost. And then nanofat is actually processed even further. It's almost like, I don't know if we have any people that do pottery at all. Like if you're pushing clay through an extrusion, it's getting it thinner and thinner. That is kind of like, it almost has a lotiony type substance,
Mm.
where you can actually microneedle that into the skin, and that has just isolated stem cells related to it. I've been actually starting to use that more and more with the CO2 laser, and I actually use that a little bit on you with the CO2 laser,
Right.
just to help the stem cells utilize some of the stem cells in that nano fat. And the nano fat itself is you're not going to get any structural changes. It's only the skin quality.
Oh, wow, that's fascinating. I didn't know
Yeah,
that. Yeah, I mean, I'm very into the stem cells, and I
yeah,
can't, I need to
and it's
introduce you
it's
to the
best to use your own. Yeah,
secretomes.
yeah,
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 I'm
yeah.
gonna have those put on my incisions. I'm obsessed with that stuff
Well,
for now.
whatever you're doing a great job.
Yeah,
And so
okay.
I've watched some of your videos. You follow my protocols really well. I think you added something else to it, which I loved. It was like a granule, like kind of
Oh,
exfoliant type thing.
oh, yeah,
Yeah,
to
which I
help.
thought
Yeah,
that's a good addition.
yeah, to help with that. I mean, the CO2 laser is, that's really the doozy that makes you look totally bananas. And that's, you
Yeah,
don't have to have had a facelift to do that. I highly recommend that everyone does one. Everyone.
yeah,
I mean, I highly recommend that, to do that occasionally,
yeah.
once every few years or
Absolutely.
once.
So the CO2 laser is the plastic surgeon's laser. It's the heavy duty laser that targets the water in our skin. Those who have a darker skin tone, who have a lot of melanin in their skin, I do have to be more wary with that, because we can have changes in your pigment. However, if you have olive skin or darker skin, we can give you creams to use before your surgery for at least a month or two that helps stabilize your pigment to still get the benefits of doing the CO2 laser. And if I feel like you can't do a CO2 laser because of your skin for whatever reason, again, the nanofat microneedle into the skin can be very, very beneficial.
Yeah. And well, I actually have a checkup with you on Friday. I'm going to ask you more questions. Like once you've had the lit now, when do you go back to your retinols, your this is your that's
Yes.
your mic when do that's another question. I don't think we
Yeah.
have to talk about now. Let me think. Hold on, fat transfer. Okay, and then we'll just one more thing. So
Yes.
you agree not to sort of piecemeal things. If you're over a
Okay.
certain
Yeah.
age, right? Like if you're
Great
over
question.
50.
Yeah, so that's a common thing. Well, someone over 50 will come in and say, I don't like my neck. And so the neck is a very um, big aspect of this aging process. It's not that they don't necessarily like their neck, it's not what it used to be. And that's fine, and we can definitely treat that. That's with a platysmoplasty. You're bringing the neck muscles back to where they once were and then lifting up. The issue is, and not for everybody, but when you get above a certain age, there are jowls, there are nasolabial folds, there is hollowing here. And specifically, if you just do the neck and just treat the neck, if you have jowls that are coming down here, it can just look like a mismatch. So if your goal is to look natural and not worked upon, it's not recommended to just do this here because we're only treating half of the issue of why our face is aging. And by just doing that half, it can just the eye, especially the people on the street, over time will start to notice that this looks really good, and then but this will continue to descend. So that's one reason. The second reason is everything it's like that blanket I was talking about and that deep layer that we know that we lift. That blanket is actually connected from here to here, all the way down to our neck, even down to our clavicle here. So if I'm going to just lift that blanket here, we're negating the benefits that we can have by lifting the blanket here, which actually pulls this up through here.
Right.
So just pulling to the side can make you look a little strange. Now, if you're younger in your 40s,
Yeah.
that you can get away with that, but that's definitely a consultation that I have, and I actually feel the tissues. I mean, age is not as much of it as the issue, but after we get to a certain age, we have to have that discussion.
Yeah, I agree. I mean, there's some people who anatomically, I know there's someone who you've been sharing, who have like a heavier neck or something, and then more of an anomaly where your neck is
Yes.
sort of hit. Yeah, I got it earlier than maybe
Yeah.
time would tell. Okay, last thing. Oh, last thing. Let's talk about the lip lift real quick. I don't want to take
Yeah.
up too much more of your time.
Oh, yeah.
This is definitely getting a lot of popularity, but I know people are like, oh, putting it as an add-on, and as, like they're shopping and like they're at the checkout, and let me get that candy bar. It's truly a commitment, and I think
Yes.
it should be something if someone wants to do it or they came in for a facelift. And I think they need to understand, like, I think the lip lift truly, like, I could not, it was something I've wanted for so long because I had such a long
Yeah.
philtrum.
Yeah.
I don't know why I have
Nice.
trouble saying that word, philtrum. I feel
Philtrum.
like it's a dirty word. Okay, the philtrum. Um, but some people don't. That hasn't struck them until they get their thing, and they're like, "But it's not just an add-on. That's more of a commitment. Like the scar needs to be worked on. You might
Hmm.
need it injected a few times.
Yes.
It's more of a process. It does change your face. I could not wait to change my face, and that way, I
Yeah.
feel like it lifted my nose. I got like I loved what it did, but it changes your face. Like I am so happy.
Yeah.
I needed it more than anything, but I think people need to know that it's not just like,
Yes. So I thank you so much for bringing that up. I rarely um, will, if someone comes in for a concerns of the face, I will rarely bring up the lip lift as a procedure simply because I want the patient to tell me
I agree.
that my lip, I have concerns with my lip. Either I've done filler, I feel like my lip is longer. So what happens is the bone structure underneath our lip gets reabsorbed. So the bone goes in, that causes the lip, the whole white and red lip to fall down here. So you are correct. There are some incisions that are underneath the nostrils here. I do my best to hide them very well. These are two separate units, so if you hide something within between those two subunits of the face, uh, it's really difficult to see that. We know that from when people have cancers and we want to remove cancers. If we hide them in specific areas, it's difficult for people to see. But having said that, it is an incision in the central part of your face. And if someone is reluctant to do that, I'm not going to be something to push them over the edge. However, somebody like, I mean, I think Emily, we had this discussion. If that's bothering you, you're aware of the procedure. We go through this. I spend at least 10 minutes talking apart about where these incisions go, what they look like. I know that your recovery involves, I don't want you to smile for about a week or so, which for you is hard to do. You're very gregarious,
I was very connected.
outspoken, vivacious person.
I
But I
was
don't
like the
want, yeah, I
queen.
don't
I
want
was
you,
very still.
I don't want you moving your lip to make those, because any movement can cause a little bit of a scarring, and you've done a great job of that. Yeah, it requires, we did a little steroid injection. I think that was a few weeks ago to help bring down some of the raised area because there's still stitches that are dissolving. But yeah, it's an extremely powerful procedure. You can make the argument that if you just did this, it can have a look that you've had a facelift because it just we as humans we feel that the eyes are one of the most important parts of our face, of course, from an attractiveness standpoint.
Mm.
But a close second is our lips. And if there's a sense that your lips are more voluptuous or lifted or that distance is shorter, it really is an attractive look. Now, you can go overboard and you can take too much skin and you can't necessarily get that skin back.
Yeah.
So that this is a conversation. I have special tools, the calipers that measure that distance. I often encourage people to look in the mirror and they can put some either chopsticks or some sort of wooden dowel to kind of get that, kind of simulate what that look will be. So it's a nice process. It's a very powerful procedure. I'm not against it. It's just something that has to be
Yeah.
handled more judiciously.
And you can always do it later. You can always add
You
it
can
on. It's not a
always do it
crazy
later.
procedure. You don't have
You
to
can do that in the office.
in the
So
office. So
lip
that's
lifts can be
my
done in the office.
that's
Yes.
what I think. Yeah. And someone was like, "What about the filler in your lip?" I was like, "I didn't have any." So it really
Yeah.
like lifted my lip.
Yeah.
It gave it a whole new. It made my lips.
Yeah. So with yours, like,
It lifted them.
so the distance between here and even the people that are following can do this from your lower part of your nostril, kind of central part, and then the whole philtrum down to the red part. You can measure that in millimeters. Um, 13 or 14 millimeters, that distance is kind of a natural looking distance. But my patients that come in are usually in the 20s, 21s. And so that's very scientifically, we can remove that amount of skin to get that look. You can have a little bit of tooth show, which is nice to see instead of having a more of a thin lip. And then when you lift, I don't know if you've had this experience, Emily, but when you lift the upper lip, it actually has this illusion that the bottom lip is bigger because
Yeah,
instead of it being, for people who have really long lips, that by lifting this, it exposes more of the
yeah,
red lip.
I
And
do.
yeah, and the light hits the red lip, it glistens more because more of it can be seen, especially the lower lip.
Yeah, I'm super into it.
Yeah.
Okay, I mean, I think we're good.
I have a question for you though.
Yes. Oh, there's Clayton. Hi, Clayton. Yeah. What's my
Yeah.
quest? What's the question?
So I want to know subjective, like you, how you feel like in this process, like doing like before you had this, and then how has it been feeling wise from the internal standpoint after doing this surgery? That's what I don't get
Yeah,
enough of because
it's
I'm not in your head.
it is insane. It's literally like I can't even explain it. It is the most surreal, unbelievable feeling. I it shift I was feeling because of the sort of the way the appearance, the emotional appearance of having this heaviness and this, which was not how I felt inside. Then you would look in the mirror looking tired, sad, and then you would become that. You
Yes.
see? I was sort of like, wait, there was such a cognitive dissonance from who I am, like
Mm,
so vibrant, body like is quite fit and I mean, I'm like a very young, very old person. And then I would look in the mirror and be like, what? And then I started to take that outer thing and internalize it. So
yeah.
now this takes off like, 10, I don't know, 10, 15 years, whatever it is. And I'm like, oh, wait, that's really who I am. Now I get to be that fully.
Yes.
So there's this re, almost, yeah, like a merging of inner spirit and vitality with the outside. And now I'm like, okay, now I could get back in the world because I started to
Yeah.
feel, oh, maybe I am done. Maybe I am getting close to like retirement. I'm looking at like, should I be getting my pension? Like I literally started to feel I was
Yeah.
like going down
Yeah.
just from because of like how I appear in the world. It's
Yes.
really weird. It's very subtle, and I'm honestly
Yeah.
trying to like unpack it because it's quite deep. But
Yeah.
I mean, I feel it's profound.
Yeah.
Do I feel
Yeah.
numbness? Yeah, the numbness is totally wearing off, but it's a really wild feeling. Someone asked it.
So
So
thank you for sharing that. So that is such a real,
it's deep.
that's the real reason why I do this. And you are not the first to say, have that kind of story related to the recovery process. And it's, I don't know if it's, we get used to looking at ourselves. We know from science that our brain development continues on. We're sharp as a tack. I know I follow you from a workout, health, and fitness standpoint. We can get our bodies ready to go, and then the
Yeah.
aging process just kind of slaps us in the face, I guess. And just to be able to do something like this again, this is a privilege. I mean, you're a healthy person. The people who sit down with me are tend to be healthy,
Mhm.
and it just that's like music to my ears because I think sometimes there is this stereotype that plastic surgery, and then a very small percentage of people actually have a body dysmorphic disorder where there's certain aspects that are so imperceptible that they want change. But that's such a small portion. The majority of people are like yourself, that you know what you want, you know what you've gone through life. You're not necessarily looking to look like you're 20 years old. There
No.
just has to be some sort of connection between how you're feeling about yourself and how what you're seeing in yourself. And I think that those are all very reasonable
It's
but like
feeling.
important goals. Yeah.
Yeah, it's really feeling based. It's not about attracting, someone said about attractiveness and beauty. I'm like, no, like it's about feeling. It's I don't know, it's really profound. And it's the most unbelievable, greatest thing I've ever done in my life. I
Well,
mean,
I please in the future keep talking about that because
I
I myself
will.
want to hear your story because it really it is something that you can't put your finger
You
on.
can't.
And but I know it's real and but it's yeah it's and
It's
you've
incredible.
said it the best I've ever heard it. So
I hope so. Oh
yeah.
my gosh, thank you. The only sad thing is like, wait, does that mean we're done? Like, I'm like, well, I need to know you forever. Like, you are. I mean,
6 months
thank you
at
so
least, and then
much.
yes, you always come by for
I
Botox
mean,
or
I have a
whatever.
few more months. I'm not done. I'm gonna have to keep
Yeah.
coming in for checkups. I'm not done. But thank you so much, Dr.
Yep.
Davis. And
Thank
I mean,
you.
you're so generous with your time. I'm gonna save this. Um,
Perfect.
and hopefully, we'll get more people to really
Yeah.
check in.
And
Have
if
an
we want to
amazing
do
day.
this like at like the 6 month mark or whatever, that's great too.
Absolutely.
Okay.
100%.
All
Okay,
right.
bye. Thank
Bye
you,
bye.
people, for joining. Okay, bye. Bye. Let's see, press end. Here we go. End.
And